Good evening, everyone. I'm Associate Prof. Gauri Krishnasamy from MAHSA University, Selangor, Malaysia. I'd like to introduce my university to you. MAHSA University, which actually stands for the Malaysian Allied Health Science Academy, MAHSA, is actually situated in Selangor, Malaysia, in a small town called Bandar Saujana Putra. And Bandar Saujana Putra is about half an hour to about 45 minutes from the main airport. And the nearest towns around Bandar Saujana Putra are USJ, Putra Heights, Cyberjaya, and Puchong. It's also about half an hour or about 20 minutes from the federal administrative capital of Putrajaya. And being a small town, something like Manipal, where I studied my MBBS, its population's about 65,000 till the end of last year. Now I go on to introduce MAHSA to you. Okay, MAHSA basically is founded by Tan Sri Dr. Haji Muhammad Hanifah in the year 2004. He's actually a medical practitioner. Recently, we've actually moved on to our campus of 48 acres in Bandar Saujana Putra. That's about in 2016-17. And we've admitted students from various countries. That's about 75 different countries, including Asian countries, Australia, UK, US, and Canada. Now, the Ministry of Health Malaysia has actually awarded us an online university, and with the COVID-19 pandemic around, we've actually been doing classes online ever since in the last 3 months or so. Now, this has provided us a borderless education through Elevate, which is called Engaged Learning Experience and Innovative Teaching. We also have open and distance learning programs that have been created to redesign the future of academic learning. Okay. Let me introduce my faculty to you. So basically, the Faculty of Medicine, Biosciences, and Nursing is the largest faculty within the university, where we actually have 3 schools within one faculty. And we have undergraduate, postgraduate, and doctorate programs. We have a strong set of staff who are academically and research oriented. And our state-of-art training facilities, because we are new, and we have state-of-the-art facilities for nursing, bioscience, and medicine. And all courses that we actually run through this faculty are accredited by the Malaysian Quality Agency. We do have recognized regional and international, we are recognized regionally and internationally. I will later mention which countries have actually given us recognition for that. So a lot of our students actually work within the Malaysian healthcare system. And as I mentioned, we've had students from all over the world who've actually entered into the workforce in their countries. Here, I actually share with you what our faculty looks like. Basically, we're headed by under the deanship of Prof. Ganesh Ramachandran, and we are divided into 2 sectors where we have the basic sciences as well as the clinical sciences. And there we have directors for each one of the sections. And under these sections, we actually have different divisions, and we have the normal, normal and abnormal body systems division. We have cell biology and biochemistry, pharmacology, and population and health and research methodologies. That's all under the basic sciences. And when it comes to the clinical sciences, we actually have medicine, surgery, and women and health. So basically, that's how our faculties are divided. This is the dean of our faculty, Associate Prof. Ganesh Ramachandran. He's an obstetric and gynecologist by profession. So I now come to say why choose MAHSA. So basically, we have got international staff and local staff who are really competent and experienced. And we do have basic sciences and medically trained professionals. We are accredited by the Malaysian Quality Agency and the Malaysian Medical Council, and also regionally in Brunei, Maldives, Mauritius, Kenya, Tanzania, Nigeria. Our aim is actually to create what we call the 5-star doctor. And these are doctors who are knowledgeable, who are decision makers, who are caring, competent, who are critical thinkers, and empathetic. Currently, we have had 6 batches already, and we have about 750 alumni out there in the working force, either in Malaysia or around the world. And this program that we have, the MBBS program, is actually a totally homegrown program. It is listed, MAHSA University is listed in the World Directory of Medical Schools, and this allows students to actually sit for various qualifying exams to actually practice in other countries. That would include the USMLEs, the PLAB for the UK, and even for India, we have your NEET exams. So students can actually appear for your NEET exams once you pass our qualifying exams. And we are very fortunate. MAHSA University is actually very fortunate because our students in the clinical years, in year 3, 4, and 5, actually are attached. They have their clinical postings in 2 major hospitals in Malaysia. That's the KL General Hospital, or what we call HKL, and the Sungai Buloh Hospital, which is our regional infectious disease hospital in Malaysia. And apart from having our MBBS programs, we also have established postgraduate programs. And our methods of teaching is actually very innovative, where we have problem-based learning, self-directed learning, flipped classroom learning, digital labs, 3D video learning, peer-led discussions, and electives. So as I mentioned earlier, we do have recognition from other medical councils. This includes India, Thailand, Sri Lanka, and Bangladesh. So most of our students are from India. We do have a good number from Thailand and Sri Lanka and, of course, Bangladesh. Okay, I will zoom in now to our program. Our model here is the SPICES model that we actually use, where we are student-centered, problem-based, integrated, and interprofessional, community-based, and we do have elective studies as well as with systematic and planned approach. As I mentioned earlier, the 2 major hospitals, HKL and Sungai Buloh Hospital, where we send our students. Apart from that, we actually send our students to the health facilities, and these health facilities are around in Petaling Jaya, Selangor, which is another popular area. It's about 45 minutes from Bandar Saujana Putra. When we initially started our MBBS program, we were based in Petaling Jaya, and then we moved on to a bigger campus in Saujana Putra. So having been based next to one of the premier universities, which is University Malaya, we're just next door to them. We've actually been given healthcare centers just around that area. So in that way, we are pretty fortunate to actually have our students based in these healthcare centers. Now, our MBBS program, which is fully accredited by the MQA, the Malaysian Quality Agency, is a 5-year program. We divide it into 2 phases, phase 1 and phase 2. Phase 1 comprises of the first 2 years, and phase 2, the year 3, year 4, and year 5. Phase 1 is basically conducted on campus, which is in Bandar Saujana Putra. And we do have visits to the nearest district hospital for exposure to our students. The phase 2 is, as I mentioned, conducted in Hospital Sungai Buloh and Hospital KL and Tanjung Karang Hospital, where they do their community postings. And the clinics that I mentioned are in Petaling Jaya. Okay, zooming into the preclinical program, which is the phase 1, which spans about 2 years. It's also known as a preclinical phase, where we actually teach basic medical sciences and its organ system blocks. We also have personal and professional development and early clinical skills modules, which are conducted across the year 2 and the year 3. And these modules actually are aimed at developing humanistic attitudes and communication skills, which are very, very important for doctors in the making. Now, early clinical skills also enable students to learn history-taking physical examination on simulated patients, as well as develop critical thinking skills. Now, I stress on this because this is what we aim to produce. Eventually, we want our students to actually have good communication skills and to actually be able to go out there and practice as general physicians before they actually venture into whichever field or specialty they want. Now, the phase 2, which is the clinical program, is actually the year 3, 4, and 5. And this is when students are actually posted to either Hospital Sungai Buloh or HKL, depending on the postings. For example, if they were to be posted to dermatology, they would be in HKL. In year 3, most of their postings are in Sungai Buloh Hospital. In year 4 and 5, we post them mostly to the major hospital, which is Hospital Kuala Lumpur. And these in year 4, in year 3 and year 4, we also post them to the clinical, the health clinics, which I mentioned just now. Most of these rotations are around 6 weeks to about 8 weeks in each posting. And for every posting, they actually have an exam that they have to pass before they actually move on to the next year. Upon passing exams in end of posting exams in year 3, 4, and 5, are they then allowed to sit for our final year professional exams, which they have to pass before they can actually be awarded the MBBS degree. Now, in year 1 and year 2, we actually have professional exams also. Those in year 1, they pass. They are allowed to venture into year 2 after sitting for the year 1 exam, and in year 2 they will have to pass that exam before they can actually get in the clinical years. Now, getting into our MBBS program is all based on what the Malaysian Medical Council has determined. So basically, we do have entry requirements, and for students coming from India, the Indian preclinical, which is what we call the +1, +2, yeah, that's acceptable for us, and we need a score of 70% in any of the 3 subjects. That's biology, chemistry, and physics, or maths. The IB International Baccalaureate is also acceptable. And if you are a graduate student, we will just have your CGPA of 3.5, and that would be acceptable for entry into our MBBS program. I say that students who actually come into MAHSA are really at an advantage because of the settings that we actually have, the facilities that we actually have, and what they're exposed to. We have an active medical society that goes out to do various programs. We collaborate with various universities. We participate in many international and national quizzes and sports. We also have cultural, social and charitable activities within the university and outside the university. We do have a mentor-mentee program, which is commendable. We do take care of our students, be it locally or internationally. We ensure that their studies are not affected in any way. We as lecturers actually go on to be, we create a relationship where students can actually freely come to us with any issues that they have. We also have accredited student counselors, and we've recently opened up our sports complex, and within the campus in Saujana, Putra, we have lots of facilities where students can actually keep themselves occupied apart from studies. Here, I'd like to share with you some of our students' activities. We've had an e-magazine called Under the White Coat, which has been commended by various universities. This is an online e-magazine, and we are now into the 6th edition. So that's about, what, 3-4 years down the line already since we've actually started producing this magazine. And here I'd like to share with you one of our university students who was actually interviewed for Easy Uni magazine, which is a Malaysian worldwide, national magazine, where he had been featured on the front cover. And these are various testimonies from students. Here I would like to share with you Dr. Frida Charles, who is a doctor now in Tanzania, in one of the private hospitals in Tanzania, who's actually doing family medicine. She was our graduate in 2016. This is Dr. Sadhvi Shriya Bunjun, who is from Mauritius. She's in the Department of Surgery in one of the hospitals in Mauritius. And here we have a doctor from Kenya, Dr. CANDIDA MUKLI Rose Miu. And she's interested in ONG, so she'll be pursuing a degree there. And here, one of our very own local doctors. These are just among a few among what we've had. Now, this doctor, DENISHAA Ramasamy, actually graduated in 2017, and she's already passed her Part 1 MRCOG exams. So what I want to stress here is the way we teach and what we teach actually enables our students to be prepared for postgraduate exams, the international postgraduate exams. It could be MRCP, MRCOG, MRCS, ENT, Ophthalm, pathology. So that's where most of our students have actually ventured into, and we've already had the first batch of students that actually qualified in 2014 who are already into the postgraduate programs, either locally or internationally. These are just a few to mention. I'd also like to just mention that we do have a set of staff who are actually well recognized and who are researchers in their fields, prominent researchers. And our staff are also external examiners to many other universities in locally as well as internationally. And from India, we are examiners to Manipal University in India, and locally we have AIMS, University Science Malaysia, and the University Malaya, and UKM, University Kebangsaan Malaysia, where our staff actually go on to be external examiners in these places. Just to mention the facilities that we actually have in MAHSA, we have, of course, the library, we have residence hostels, we have the amphitheaters and the sports complex, to mention a few. And finally, I'd like to just say that our aim is actually to produce caring, competent doctors that are cognitively, psychomotively, and effectively activated. These are a few questions that I've actually prepared. Some of you who would be interested in joining MAHSA University for your MBBS programs, our commencement for a new intake to 2020-21 would be in October 2020. And for this is actually for locals where the loans are concerned, but we do have scholarships also for national and international students, such as the Sports Scholarship, the Haji Abdullah Academic Excellence Scholarship, Continuing Education Scholarship, and Alumni Scholarship. And you can get into our website at www.mahsa.edu.my to look at the other scholarships and financial aids that we can provide. This is the fee structure for our current course, which is very, very affordable. We're looking at just below 500,000 ringgit. As I mentioned, we've had a sports complex, so with an Olympic-sized pool, gymnasium, football field, squash courts, badminton courts. We have various student clubs and societies, about 30 to 40 different clubs. And we do have exchange programs available also. So for those of you all who are interested in doing an exchange program, especially during your clinical electives, you can venture to another hospital overseas where we do have we do encourage students actually to do that. It's a 3-week posting, so that's encouraged. In summary, I would like to just mention that the MBBS program that MAHSA University has is designed in consultation with the panel of local as well as international experts. So we do review our programs our modules every 3 to 5 years as recommended by the Malaysian Medical Council when they do their auditing. And so far we've done very well, resulting in a highly sought after curriculum that combines theoretical learning as well as practical sessions in campus and in hospitals and health clinics. Now, our students actually do gain experience because of our panel clinics. Oh, sorry, our panel hospitals. And we are recognized by the Malaysian Medical Council, Ministry of Health, and the Malaysian Qualifying Agency. And the MBBS is awarded by the MAHSA University. We are not in collaboration with any other university for this. It's a homegrown program. Yeah, and lastly, I'd like to just mention that we actually have a faculty e-news, which is updated from time to time with our staff achievements and student achievements.